Good afternoon, good morning, depending where you are located, and welcome to the fourth session during Next Patient Week, which makes me extremely happy because I can't lie, it's my favorite one, with a very interesting and intriguing, which is storytelling in medical affairs, articulate the science. Today, I have a great pleasure to welcome four extraordinary panelists. So I will start from left to my right. So first of all, hi Sebastian, how are you?
My pleasure to be here. Thank you for the invitation.
Jose Antonio Vidal from Novartis. Hi, Jose Antonio.
Hello, thank you so much for inviting me.
Bernard Ng from Bayer.
Hello, Dario.
And from Australia, Marcus West from 60 Seconds. Hi, Marcus, how are you?
Dario, great to be here.
Thank you very much. Before we kick off, we would like to engage with the audience. And this is that actually yesterday we officially launched a survey related to that particular theme, which is storytelling in medical affairs. And in the chat box, you will find a link to that survey. So we kindly appreciate if you can take 10 minutes of your time and complete the survey, out of which we will generate a very interesting report. So first of all, let's kick off this. And I would say that storytelling is definitely one of the most powerful skills which we as humans have in every segment, professional, personal life segment, absolutely any segment. And storytelling or story selling, like many people are claiming, is the process when we try to make a simple impact on the other party so that the message is understood, but in a rather simple, articulated way, and which at the end of the day convinces the other party. What I mean under convince is not just a sales pitch or just a commercial effort. What I mean is we storytell all the day long, right? Which means once we need to tell a story to drink a beer with our friends, right? It's storytelling, which means the friend needs to accept this invite, and it really depends about storytelling and of course about the relationship itself which we have. So extremely pleased to speak about storytelling in medical affairs, because medical affairs definitely emerged as the hottest pharma field during these pandemics. And let's kick off this discussion and start with the first question, which is, let's start with the basics. And this is, let's define what is storytelling in medical affairs before, in, and after COVID-19. And I suggest maybe we can start once again from left to the right. So on the left side, we have Sebastian. So Sebastian, please, could you kindly share your opinion about it?
Thank you, Dario, and again, thank you for the invitation. A pleasure to be with this panel of colleagues, and certainly inspired also by Marcus and some of the work that I've seen he's done as an expert in the field. I was reflecting about this, and I would say that, to me there are three components, right, to this very relevant question: that what defines storytelling in medical affairs before, in, and after COVID. So let me tell you what I think about the three components. One is about what is storytelling, and of course we can talk about that. You made an introduction, but we can define a little bit about what storytelling. The second component in that question is, why does it matter in medical affairs, I believe. And the third component is about COVID, no? How COVID affected. So briefly, I would say that storytelling, it's the ability to convey the importance of an idea or scientific data, in a way that matters, and more importantly, resonates with a particular audience. I think that's critically important, because we'll come back to a moment. I think the idea of understanding the audience, it's critical. Many times we think about storytelling from our perspective, and we forget that the story needs to resonate with the audience. So we can come back to that. The second point of this deconstruction, if you will, of the question is, why does it matter in medical affairs? And there's no doubt, right? We all know data of all sorts is exponentially increasing, and it simply is not compelling enough to share results and talk about data with the HCPs and the different stakeholders that we engage with. Clearly, that data, that evidence, that science is at the core of what connects us with the scientific community. But it is not just about that. There are patients, there are stories for those patients, there are HCPs, challenges, there's context, there are biases and preferences, there are previous experiences, and there are access and care pathways challenges. So all that really matters when we think about storytelling in medical affairs, and particularly when it comes to our teams, the field teams, no, as a starting point, if you will, the MSLs. And the third component is COVID. And without making it too long, the way I would like to deconstruct what COVID means for this context, I would say there are three elements. One is, I alluded a little bit to, is that COVID probably forced us to understand better what our customer needs. Not because we didn't do it before, not because it was ignored, but in a context in which the pandemic is hitting and we can't engage with our customers in the same way, we need to understand what are the ones that want to engage with us, how, at what time. We need to understand what are their needs at that moment, and not just to think about what we want to share with them, but what they need at that moment. So it's the first component that put that customer, stakeholder, not only centricity, I could push the boundary to say obsession in understanding what they need at the center. The second piece is, and COVID put in front of us, in particular for medical, the element of multi-channel. But multi-channel from the perspective of understanding what does it mean to be effective in a phone call, because that's all that we may have, or an email, or a Skype, or a WebEx, or even a text message, depending how we engage, right? So that multi-channel element, it was another thing that COVID put in front of us, and definitely we're here to stay. And the third element, and I think it's a little bit broader, but it will be important and definitely long-lasting, it's the balance between the urgency of the pandemic situation with understanding continuity of care, and farther along, what does it mean for resilience in healthcare? So again, this is a theme that is a bigger theme, definitely that will be long-lasting and will require a lot more of us. But I would say that these are the key elements, right, that COVID put in front of us. Some of them are more immediate, and some of them are going to be more long-lasting. But those are my three key insights about this question.
Thank you, Sebastian. Let's move forward with you, Tony. The same question.
Very good. Thank you, Dario, and thank you, Sebastian, for a very wide opening. So first of all, for me, storytelling, I mean, it's an art, right? You need to define the characters, you need to define the setting, the plot, the conflict, and finally the resolution. And that in every story you have these elements. So when we talk about the pharma storytelling, there is also characters. There is the hero, the villain, the conflict, and sometimes the hero is the company, sometimes the hero is the villain, sometimes the drug is the hero, sometimes the prescriber is the hero. And you play with those elements to make something that is engaging and emotionally important for the receptor. That it can be the physician, it can be the healthcare system, it can be the patient. But something that for me is interesting also to explore is how different is storytelling in medical affairs versus storytelling in marketing, if any. So trying to go back to these classical storytelling elements. So probably for marketing, the pieces that they pay attention is about the drug in itself. So they focus in the drug as the hero, and maybe in the happy ending, and then they get married and they leave. I think for medical affairs, it's a little bit more complex than that. We need to focus in the setting. We need to understand very well the environment, to understand what is the patient role in all of this story, how the other elements of the healthcare system will be entangled in our drug, right? So the medical affairs story probably is much more complex and more holistic than the marketing message that normally used to be more at least more straightforward. In terms of also in pharma, something that is different versus regular storytelling is that there are many people telling different versions of the same story, right? So it's not like a regular movie. It's more like the Pulp Fiction movie, where the characters sometimes they are the good ones, but eventually they become it's like John Travolta, right? In Pulp Fiction, and for half of the movie he's the good guy, and suddenly he's the bad guy. And when we are talking in pharma, there are other guy is telling the same story from a different angle, right? So you come to the prescriber or the physician explaining that you are the solution to the conflict, but there are other people telling the same story with different characters, and then the payer think that you are part of the problem, or and then it's like competing stories in the same plot. And last, you say pre, post, and the COVID thing. I think COVID has been a kind of tsunami that has disrupted all the stories. And sometimes it changed also the characters. For many years, Pharma was the troublemaker, and suddenly with COVID, we are the hero some way, like solving the pandemic, adding innovation that can make us resist to this problem. So for me, COVID has redistributed the cards some way. Like in a poker game, you have new cards and you can play these cards differently because you have like the system has been rebooted and you have the opportunity to position yourself different in this pharma storytelling. And I will stop here.
Thank you, Tony. Just to build on that, I would say that this hero comparison is very similar to this hero's journey, which you all most probably very well know, and which actually comes from Star Wars, right? So I think that this parallel of the hero journey might be a very good example for storytelling, not only in medical first, but in every life segment. So thank you very much. Bernard, let's hear your opinion from Pharma as well.
Sure. I mean, for me, a good story, the purpose of a good story is to engage the listener. And we do that because whether it's the consumer, it's the patient, or it's the physician, we want their attention. Because previously, it's easier for us to get their attention because we can at least see them face to face or have face to face meetings with them. Today, all those has gone. It's a reboot. Sometimes we drop a text, sometimes we drop an email, we get a Zoom appointment, sometimes we don't even get any appointment or any response. So that story, the foundation is still the same, pre or post-COVID. How do we get them to engage with us so that they want to listen more? To me, that's super critical. Right? So the start of the story needs to be engaging, and then as the customer, the consumer, the patient, or the physician engage with us, we need to make it relevant, as Sebastian, as Tony have mentioned to them. And that's why it is so difficult, right? It's not just a standard message where we can just blast out. You need to craft it to the relevant audience so that they engage. And this is where a good medical affairs team knows how to craft this. They know what to take and they know what to serve to the relevant audience. So I'll stop there because COVID or no COVID, the foundation is still the same. We need to be relevant to the audience so that they engage with us, so that they can listen more to our story.
Very good, Bernard. Thank you. So that's the Pharma perspective, but let's hear Marcos coming from the coaching coaching perspective, and to see, I mean, how you see that currently Pharma is defining before, in, and after COVID this storytelling. What are the issues which you face as a highly appreciated coach?
Yeah, I think definitely the big difference, as a few of the guys have touched on, is that COVID has meant that suddenly medical storytelling is very much center stage, and it is the story. Maybe the American election briefly, came onto the front page, but even then, the big story of the American election was COVID. So I think that is a fascinating opportunity. To me, the principles of storytelling have been the same since Aristotle, and they involve structure and character, and essentially taking the audience on a journey of the imagination. But critically, I think stories always need to come back to that principle of the audience and eliciting emotion in the audience. And no matter what we're communicating, we have to go beyond just appealing to people's mental capacity and appealing to people as human beings. And potentially COVID has meant that you know, the urgency for humanity as a whole and health in general and well-being is suddenly very much the most important thing, more important than the economy, more important than geopolitics. Health and global health and our attitude to that is absolutely critical, and that's a wonderful opportunity for people in this space to be able to wrest that narrative and be able to engage people in a really fascinating way.
Thank you, Marcus. Moving forward to the next question, which is Sebastian, you would like to add something?
Yeah, it was just 1 second. I was just wanting to say when you mentioned, right, Star Wars, for example, right? I think it's a great analogy, something I came across recently in the context of everything that is being said, particularly Marcus at the end. I mean, it's critical, right, to make it about the audience. And like Tony was saying, for the most part, right, the audience needs to be the hero to take in that journey. And many times we're focused too much inside, right? So using the Star Wars analogy, one thing that I learned recently is that who is Luke Skywalker, right? And really, it's not us, for sure. When we tell the story, it might be the audience, might be a particular context, the health system, but we need to make an effort to remove it from us. And the role that we should play is more the role of Yoda, if you will. It's more the mentor of that hero. But we need to avoid the temptation to try to become the heroes of that story.
Exactly. Just to build on that, maybe we can give an even more recent example, which is the very famous Spanish TV series on Netflix, Money Heist, right? And Jose Antonio actually mentioned that a villain can become a hero, and this in particular is the case, which means a thief becomes a hero, a national hero, that they are actually rising against the traditional system about the capitalism, etc. Which means it's I think also a proper example of how storytelling can actually mix things up in a completely different direction. Right, let's move forward to the next question, which is very important because in many ways, I would say that knowing something and telling it properly is not actually a synonym. So the question would be how to balance the science and the proper information value to the counter side. Maybe this time we can start with Marcus and build on his views further. Marcus?
Yes, thank you, Dario. Having worked with a lot of people in coaching who work in technical areas, be they professional services or medical science, I do find that there's often a certain piety around being correct, being scientifically correct, and that above everything else mattering the most. And of course, that's certainly true. That to me should be the starting point. And I think from there, really effective communicators are able to then reimagine those elements of the science to be able to put them into some sort of shape, which can then capture the imagination of the listener. And that is the challenge of all communicators in the end, because even medical science liaisons, anybody who needs to communicate a message needs to understand how they take the core elements of what they're saying, even if they are quite dry as core elements, and how they're going to put them back together in a way that is memorable. And that's the challenge for everybody who needs to communicate. And I think being able to just say, well, you know, this is the science, that's what matters, I don't think you're going to be able to capture people's imagination, and you're certainly not going to be able to maintain their attention by simply having that position. You have to probably be a little bit more adventurous than that, potentially.
Thank you, Marcus. Just to add, I would say this is very similar like the PowerPoint effect, right? Which means if you have like 200 bullets, then most probably you will look smart, right? Which definitely is not the case. And we see that even many companies, including Amazon, are having meetings without any kind of PowerPoints in the background. So it is purely about storytelling. Let's move forward to you, Bernard.
Yeah, I want to add on what Marcus mentioned, right? A lot of times people are just going there and telling what they want instead of really understanding what the audience wants. Right? So to me, very important, the balance of science and information to the story starts on the foundation is how long do you have and who your audience is. Because you need to tailor it, right? If I have 20 minutes, I would tailor it differently. If I have a corridor call of 2 minutes, the messaging and the positioning will be very different. Couple that with the audience. Am I talking to a physician? Am I talking to a specialist? Am I talking to a subspecialist? That is very important. A lot of times we are not cognizant on how we position this, and we go in with all the information and we just blurt it out thinking that our job is done, right? So I just want to re-emphasize who our target audience, how much time do we have, and then create the story, as Marcus says, to engage with the audience.
Thank you, Bernard. Tony?
Yeah. So 100% aligned with Marcus and Bernard, and just to add another angle is we need to be 100% based in science. So science is not negotiable. It has to be credible. It has to be robust. It's not negotiable just because the story needs to look pretty that we bend a little bit, and because we as a sector, we start in terms of credibility, we already start with -10, right? There are other guys like that they are like without suspicious that they are neutral, and because we come from a business, so it's always under scrutiny that, okay, is this real? Is not real? So we need to be 100% super accurate and super solid. But saying that, at the same time, we need to send a story that engage the audience with an illusion and with an aspiration that their own reality can be better, that you can really help them to change their own reality. So we need to make them aspire that this new innovation or us as a company, we can help to change their own reality and patients' lives at the end of the day. So aspirational, yes, over promising, no. And I think at the end of the day, we have so many nice examples to prove that we have changed lives. I mean, we have increased life expectancy with our innovation in these last 50 years amazingly. There are diseases that we are curing blindness with genetic therapies. We are curing cancer that years ago it was unthinkable. So the stories can be absolutely aspirational, but super solid and super robust, because in the moment you are caught in something that is an exaggeration, or then you are lost, and then you will be basically neglected, and then you will not change any behavior. You will be detected. There will be antibodies detecting any kind of weakness in your message. So super robust and super solid rationale, I would say.
Definitely. Thank you very much, Tony. Sebastian?
Just briefly to touch on two things, actually connecting to something that Bernard said and Tony, to add just another angle. One was about the I mean, critical, right? That element we were talking about, the audience at the center, right? So that element of customization, because even the audience, it's okay, who is that audience at what stage they are in? So, for example, we know that in commercial, right? They divide audiences in or targeted, panels in adoption ladders, right? And there are journeys into that ladders. Of course, in the case of medical, scientifically, ethically, compliantly, clearly we're not linking things that way, but there are also ladders of medical knowledge, medical advocacy, understanding of data, clinical experiences, right? Compliantly and ethically, I repeat, like Tony was saying, science is paramount. I mean, we cannot deviate from that core of who we are, right? Independently of what we do around it. So what I'm saying that there's an element of understanding the audience, and at the same time, all the sub audiences within the audience, and how you bring along an audience in a journey from a advocacy, clinical experience perspective is absolutely critical, and it's relatively new in medical affairs in general. So that's one piece. And the second piece, connecting a little bit more with the storytelling itself, just to add something here. Clearly, of course, engaging hearts and minds and all the emotional component and all that we are describing is absolutely critical. One element that I think also needs to be, and I think it's a skill, right, that we all need to acquire, become better, help our teams upskill. It's about data story, telling stories through data, right? I mean, of course, it's also an element of emotional appeal, but let's not forget the world that we live in. And like Tony was saying, I mean, the data, the science is growing exponentially at a faster pace, even that specialists or even us can sometimes grasp and understand. We need to be continuously upgrading understanding. So, I mean, Mark Benioff, right, the CEO of Salesforce some time ago, I mean, has said that we need to sort of breed or educate a new generation of leaders, because everything is data. The world's being digitized. Everything is turned into data. So how you interact with that data and what stories you tell with data. So just wanted to provide also that perspective, right? There's an element there that is beyond the storytelling perspective, from a narrative perspective, that is critical, but then is how all types of data, thick, thin, fits into that, and how one articulates data into a story.
Thank you, Sebastian. In the meantime, I would like to encourage our audience, if you have any questions, just drop them in our question section, and we will pick up some of the most interesting and promising one and ask them to our panelists. Third question, extremely important from my perspective, and this is how to keep the team aligned with proper skills and knowledge in storytelling. Because frankly speaking, we launched that report which we just showcased, and according to current response, 60% of the teams never ever received a training inside storytelling in medical affairs, which is quite shocking for me for the time being. So let's start this time with you, Tom. Tony?
With me?
Yeah.
Okay, good. Yeah, so I'm normally we focus a lot in the knowledge part, right? It's like if we feel that the team is well prepared to answer every data request or every data gap or every competitor evidence, we feel comfortable. But that's just only 50% of the story, right? So at the same time that we are sure that our people and our teams and our MSLs and medical managers, that they feel comfortable with the content, we need to make them feel comfortable also with the soft skills of explaining the story, understanding the non-verbal feedback from the receptor, from the listener, understanding how to follow up a question with open questions, and this is another kind of discipline, right? You can be the best scientist in the room, and you are totally, I mean, we all have been in the university, and we know that not necessarily the ones that knows more is the one that teach better, right? So is another kind of skill, and you need to practice among colleagues. You even need to practice with your family, explaining what are you doing, what is your job, what is the brand, and being able to explain it in very simple words, but with the energy, and finding the energy in your story, understanding when your story is becoming emotional and you feel passionate about what you are explaining. So it's also practice and practice and practice, and it's, I would say 50% of the time should be like that, and to counterbalance what we are, the how and the what. I think we need to make much better effort with that kind of training.
Tony. Sebastian?
Yeah, I echo 100% what was said, and I like what Tony said about the best teachers, right? In university and school clearly are not, right, the ones that know the most. So a lot there. Yeah, just briefly, a couple of thoughts or just a couple of things to add. Um, one is about just reflecting, right? And again, I'm just going back to a little bit the data, the digital world that we live in, the exponential times, right? There's an element of evolution in how we think about learning. We think about how learning and development organizations in general have changed their names, of course, that to learning and performance, right? And there's something intrinsic there, right? One could argue that linear learning, it's acquiring knowledge measured by taking a test, if you will, and then you pass, and then you go with your knowledge, who knows to do what. Learning and performance, it's, one could argue, acquire and creating new knowledge, right? Measured by acting, doing through impact, or measured by impact, right? Through doing. So the reason why I say that is because, when it comes to our teams, because now we're talking about skills of our teams and what we expect from them. I think we need to really go back to a lot of the basics and really push the elements that are going to make all of us better storytellers in everything that we do. The way we think about training, as put an example, right, and how to think about it. If someone is going to do a course, for example, supported by us. Again, I'm trying to take it right outside of the daily. Okay, fine, you do the course, but what do you do with it? Come back, tell me you did the course, pass the test, great, you put in your curriculum, the performance of the year. I don't know, come back and share with the full team. Tell a story. What was that? Share the learnings. Can you tell the story in 3 minutes? I mean, there's something I came across a couple of years ago called the 3-minute thesis. It's unbelievable. You see people that are, PhDs, so they're having to tell their whole thesis in 3 minutes. And actually, you realize that when you put a lot of practice, like Tony was saying to it, actually 3 minutes, it's kind of enough. So what I'm trying to convey with this is that when I think about skills and aligning a team, I think we need to put a lot of conscious effort on how we shape the day-to-day. How do we make them work with us? For example, if they're going to present something to us, do we want them to be master storytellers outside, but then when it comes to us, we sit through tens of slides and data dumping, and we're happy because of that? Or we are pushing them and us, all of us, into being able perhaps to better use of data, infographics, minimalistic slides, better executive summaries, better narrative crafting, right? To tell maybe a summary of what your plan is for the year or things like that. So I stop there, but the message I'm trying to convey with these 3 or 4 thoughts, I hope they were relatively well articulated, is I think we have a responsibility to make every day, in every single thing, in every single point of interaction, a learning, a narrative experience. So then it becomes more natural, right? So I stop there.
Thank you very much. Marcos?
Yes, Dario, look, I think in terms of getting people aligned, I think there are 3 things that you can do to help activate this process. I think there's got to be a culture of practice and reflection. And I often find that when people practice any form of communication, but storytelling in this case, they often write things down, but they don't speak them out loud. And so I think if you want to practice something that you've got to say to an audience, then it must be practiced out loud as a musician would practice a musical instrument. So I think that's very important, to engage your voice, think about how something sounds, and that way, how the emotion potentially and the feeling and the, how you're actually present vocally is very important. And then I think the second part is that you need some input from somebody who has more experience, a mentor, a coach, a medical manager, somebody who also has experience, but equally has some coaching of themselves to understand what coaching is about. Because I think sometimes we see people in the role of coach, but actually they're not nurtured themselves to be able to understand the privilege of their role and also the skills associated with it. And the last part, which I believe is potentially the most important, and it sort of feeds back around to the beginning of the individual practicing, but that's sharing best practice. So when you do have somebody in the team who's clever at being able to illuminate a particular aspect of the medical science through storytelling, then being able to share that and celebrate that and understand why it's effective, and potentially even to borrow it and to repurpose it for yourself. That, I believe, is what makes effective teamwork.
Marcus, Bernard, same question.
Yeah, I mean, building on what Marcus said, right? To align proper skills and knowledge, we need to have benchmark. And to build benchmark, you need to have good standards, which is understandable by everyone. With the era of technology, people should be able to record themselves saying something. It is such a simple thing to do. And for two reasons. One, when you look yourself in after you're trying to present something in your recording, you most of the times will realize something. And then when you share it with your other members, that is when the standardization comes in. That is when we can teach people to say, this is good, this is what you look for. This is not so good, this is what you should avoid. And that is why it is so easy for us to do recording of whatever we want to do, role play. We use a face-to-face role play. Now we can do a video recording, send it across and have a discussion. And as Marcus said, if you record someone that is good, you'll be able to pick up a lot of things. And hopefully that becomes the standard and you slowly raise the bar for the whole organization.
Thank you, Bernard. In the meantime, we received an extremely interesting question from the audience, which I will read right now. And this is, how do you envision the future method to interact with new generation of physicians, as the medical school curriculum have been revolutionized in comparison with the prior generations? That's an interesting one. Who would like to go first?
I mean, perhaps a quick comment. Video, just I put it out there, right? Video communication, crafting good videos, short videos, right? As part of the way we communicate, clearly is an element that I think is a common denominator of younger generations that getting more used to consume information, data, study, acquire knowledge, connect with others a lot through video. So just that simple point, the word video.
Thank you. Others? Don't be afraid.
Yeah, but no, I mean, being honest, and I'm gonna be fully transparent. I'm a little bit scared about the new generation. I'm not, I look like a grandpa here. But if you go to the parks right now and you see the adolescents, maybe not now, but when you look them all in the cell phones and they are in a circle, but each of them with their own cell phones, one day they will be the doctors of the future, and these guys, they enjoy more a screen than a human being, and that for me is a little bit scary. But I mean, eventually we will need to deal with that, with medical doctors, that they feel more in control when they have the information and they know and they navigate, than when they receive a unique and monolithic info from a company. So I think we need to get engaged in this more dynamic and surfing the information, than having very structured and symposia with 5 speakers. This is the content, blah blah blah. So being able to offer to that generation that enjoy to navigate the content at their own pace, probably we need to deal with that. not easy, not easy at all, especially because in our world we need to have everything pre-approved by 2 or 3 layers of attorneys, scientifically, etc., and how we answer to this dynamic content that is almost created on the spot. So let's see. It will be fun, but we will need to adjust to this new way of incorporating and acquiring information.
Definitely. Anyone else?
I think gone were those days where we can tell them and expect them to believe what we're going to tell them. Right? And gone were those days where you have top key opinion leader who can say something and the whole world will follow. This is the era of micro influencers, nano influencers, where I mean, the social media environment is where you can see, right? I mean, the doctors will also more or less follow that phrase. You have micro influencers, 2,000 to 3,000 followers. One person says influence the rest. So that community will come, and we are already seeing it, right? The younger generation, they have their own clique, they have their own community. They discuss in their community. Anyone that is not in their community is not really credible. You need to break into the community. So we need to adapt. We need to be able to progress with times and also catch up with the media that they are using, because there are multiple platforms out there which I would say the pharma organization is still not ready. Right? I mean, now we have Discord, we have all those things which we have never thought about.
Marcus?
Yeah, it's a very interesting subject, isn't it? Having 3 children myself, and seeing the way that they like to engage with 3 screens simultaneously. I think that's sort of the way they tend to interact. I would say just one word of caution, and that is probably around misinformation. I think there is so much information that perhaps when I was growing up, it was easier. There was just more single streams, and we were able to go, okay, that's not true. But we pretty much can trust most of this stuff over here. Now I think there's so many competing narratives, and we've seen just in relation to COVID, just all this stuff that's constantly churning this information. So I do think that the ability to be able to sift through that information and then to return to the science and be able to use that as a lighthouse, if you will, to guide you. I think that becomes even more important in a time when there's so much stuff that can distract you unnecessarily.
Yeah, this leads me to think about, based on the words influencers and misinformation, that this morning we had another session which is misinformation in today's times. And from the other angle, actually, since information is so accessible and only on Google per day you have 1 billion searches related to medical information, this truly leads to this way of misinformation, because today's average person he won't talk to the doctor, he will talk first of all to Google, right? And you actually seek for sources which are just confirming your opinion. And in some way that's quite spooky and quite dangerous. But okay, that's another theme, but definitely also something which should be tackled. Another question, and here I would like to encourage the panelists who would like to give a concrete example, and this is, will it be possible to expand on some of the ideas here, structure, characters with a real example or examples? Anyone who would like to give such examples? I believe Marcus is fine to give, but anyone from Pharma?
I mean, but the vaccination story is a beautiful one, right? I think there will be movies one day about this. Probably there will be good movies and bad movies about this. Right now, it looks like a very bad movie, but eventually in 20 years, this will become like a story then. And how this the whole thing will change when a vaccine is on the table and the science win. And I think that will be, I think it's the best rationale against negationist and the life before and after the vaccine is going to be so different. So I think if you articulate this story, it's going to be beautiful.
Thank you, Tony.
Yeah, another thought that I think that's a great example. Perhaps I'm not going to give a concrete example, but a concrete context. I mentioned at the very beginning, right, that COVID also puts on us, the reality of the importance of the resilience, right, of the healthcare ecosystem, rather than just thinking about pure efficiencies. It was alluded also by the other colleagues, right? Pharma in many aspects, in collaboration, in private partnerships in many cases, to be fair, but definitely pharma driving the engine of innovation and being, right, the hero in many aspects. But going back to resilience, I think that a concrete or relatively concrete example is, I think we will have to think about when we go forward now with new products, new launches, and we engage with the medical community. I think we'll have to be a little more conscious about the context in which these new therapies, combinations, right, play, based on potential austerity measures, if they take place, right, in one part of the world or not, based on reprioritization, right, of care in different settings, availability of budget, a lot of things. So again, it's not a hyper concrete example of say, okay, I'm grabbing a molecule, I'm giving you a speech, right, of what exactly means. I apologize for the background noise. But I think it's an interesting challenge that is on us on understanding how we're going to craft those stories of new data, new science, new combinations, right, in newer context within the healthcare ecosystem.
Thank you. Marcos, Bernard?
Let me give you an example of the character conflict and resolution. So the character here, let's talk about three characters. One is a 60-year-old man who has a post-myocardial infarction. So he's got a myocardial infarction beforehand. He's supposed to be on aspirin. Right? Another character is his grandchildren, who always comes with him to visit the doctor. And the doctor is the third character. The conflict here is that this patient at 60-year-old feels he's well. Heart attack 10 years ago. Why should I continue aspirin? I'm well. I don't want to take it. There's no benefit in it. The conflict here is then for the doctor to, how does he then convince this patient to continue taking his aspirin or whatever statin that is needed? Not for himself only. How does he then turn it to say, okay, you're taking this not only for your own heart, but also for your heart of your grandchildren and your family. And how do you then get a resolution? Because we want the doctors who is supposed to be prescribing that to feel good, to say that when you are able to convert this patient who is not compliant to a compliant patient, you are not only saving him, saving his heart, you're also saving the heart of his family or his grandchildren. So this is just an example and how you can craft a story around there, right? And there could be campaigns and all those, but that is just a summary of what I could give you for tangible examples to the audience who asked.
Thank you, Bernard. Marcos?
I think my two observations here. I wouldn't want to jump in, being from a non-science background, into giving concrete scientific examples, but one story which in the COVID period, which has stuck in my mind, is of the two husband and wife, the Turkish husband and wife that live in Mainz in Germany, who've been sort of instrumental in creating one of the vaccines. And just the way these two very talented scientists have devoted their lives and been enormously successful in a sort of worldly perspective. So I think from a whole range of perspectives, they've had this stunning success, but they seem so totally unaffected by it and totally motivated by the idea of doing something for other human beings, that idea of service, and completely unaffected by all the other stuff. What they're interested in is delivering a solution for who I believe is the most important person in every health story, and that is the patient. I think if you can come back to the patient and that the perspective of the patient, the person who's in pain or suffering, and how what you're doing is making their life better, then you're pretty much on the right track.
Very good example, and if I may add, I would consider this inventors of the COVID-19 vaccine as pure influencers, not just in healthcare, but on a global scale. But unfortunately, this is not even qualified for a average influencer these days, right? Which means that in some ways, I think that the younger generation also are having some very, very bad connotations in terms of who to follow and who is influencing their life, right? And but definitely very, very worth to consider. Last question, since we are slowly running out of time, with only 9 more minutes to go, and this is what's your outlook for storytelling after this whole crisis finishes, after this whole pandemic finishes, after we go maybe partly back to face-to-face, partly back to digital, or stay with digital? How will storytelling look like in this environment? Maybe this time we can start with you, Marcus.
I think a really important thing that we see coming out of this whole experience is, even though a lot of us have been cooped up in our houses and interacting remotely through the camera, I think in some way, in some strange sort of way, we've actually come closer. I think as a human race, as humanity, we've started to be more empathetic and more caring and more understanding, and being able to see others' perspective. And I think that is a good thing for all human beings and how they interact, but especially for medical science to be able to bring that human being very much into the forefront and be able to focus very much on them. And I find in the act of interacting, one thing that I've really found with video teleconference is that it's very interesting how slides, to me, only really work for a little bit. You can do a slide presentation when it's in the background and you're out the front. But I often find when you present in a virtual situation and you've got slides and you're a tiny little head in the corner, you need to remember that it's still one person talking to another person about something that happened that creates the magic in a human interaction. So if we keep coming back to that, I think that's enormously important.
Thank you, Marcus. Bernard?
I think life will never be the normal again like we used to have pre-COVID. Even though we have the vaccine, even though we are back to normal, the industry and also the healthcare professional will adapt. We will not see that much face-to-face. There will be much more virtual engagement as we move forward. Even conferences now, they realize actually virtual conferences, while some of them don't like it, you actually reach more. You actually reach much more, and some people realize that it saves time. Right? So I believe moving forward, there will be a mixture and a change. And virtual, whether it's teleconference, will play a bigger role.
Thank you, Bernard. Tony?
I was just waiting if you would say that teleconference will be the new normal, and I was gonna react like, I hope not. I think as human beings, our brain has been, the software has been programmed for millions of years, and we really need to touch and to smell and to see each other and to understand a little bit the energy behind a relationship. So hopefully we will be back, and of course now we have experienced that there are many trips that we can save, and it will be better for the ecology, better for the planet. But when there is something important to be said, or an important decision or an important agreement, the human connection, the ability to engage and to see that we are all in the same boat, I think that will require more than ever to go back to this human context. And so I think this will not change a lot. For important conversations, we will be back. Maybe the thing that has changed is that now we really see that investment in innovation, investment in science, investment in healthcare is not just expense. In the line, one of the lines of the budget for 2021 is an enabler of the rest of the activities, the economy activity, the human activity. So I think this has been super powerful, and those countries that really manage because they have this buffer of investment to really manage with over demand from the disease. Those were the countries that really went through easily, not easily, but easier than other countries. So I think that also will help our storytelling, how investment in science will eventually pay out.
Thank you, Tony. And I have to say I'm fully on your side. Sebastian?
Yeah, just I concur with everything that was said. Perhaps I can simply add a little. It's not a story, but just a little bit of a like a story that I witnessed this weekend, and it connects to other things that we were talking in the previous question as well about micro influencers and where things go. Right. I was following the ASH Congress, the American Society of Hematology Congress, this past weekend. And this is something that I started doing before actually COVID, right? I call it the rise of the digital influencer, and it's very interesting to see, right, how microcosmos, highly scientific, well curated, are created, right, in some aspects of social media. So Twitter is practically the only one that I use for not writing, but just to curate my own sort of bubbles of content and communities. So scientific, I like to do that. And so I was following Ash, actually fantastic, right? On Twitter, creating my connections and going from data sharing, from data presentation to editorials to comments. But the one thing that really was amazing was a lot of these, and these people were OLs, like really top people in their game. And some of them were also sharing pictures, right? This is the best. I mean, although I miss the guys, this is the best Ash I can watch this plenary and cook at the same time. And they were putting a picture, right, of the iPad and a session and then cooking. There were things like that. But there was one person at the end that started like a little thread of discussion. We was, well, I think we need to talk to the society, right? I think this needs to be here to stay. From a scientific information, if you will, or scientific sharing perspective, kind of it seems to be more optimal. But then the second part was, but how are we going to do the social encounter? Because I really miss having the coffee with this, talking about this, discussing the data more in depth of that. So kind of trigger a little bit of a discussion, of course, have joke, have real, of, well, in this idea of reimagining things, maybe, and this I'm going to do my own words. No, please don't quote me. I'm not quoting anyone, but it's maybe the Congress of the future. And I'm stretching the boundary here, of course, but it's the Congress of the future, a virtual Congress, then followed by a in-person gathering that is 100% for coffee, dinners, drinks, exchange, justified by the science. So all that just happens scientifically. People are going to get together to discuss them more in depth, but without having to rush from one session to another, missing another session. So anyway, I stopped there, but I found it very inspiring, insightful. Who knows what it could be? But completely agree with my colleagues, right? The human interaction, it's absolutely critical. Definitely, I believe that models are going to move into hybrid ways. I think the challenge to all of us is how to continue tailoring, right, those messages, those stories to each of those mediums, right? But I completely agree that the human factor, it's absolutely critical, and hopefully we'll come back.
Definitely. Just to add this, you already have some recent studies and many articles. For instance, remote work. At the very beginning was perfect. Everyone just liked it. And product-wise, it's pretty brilliant. But still, we miss these little inventions. We miss these relationships. We miss this chemistry when ideas happen, right? And already, for instance, some companies are claiming that their innovation index went down because people are interacting and inventing in best scenarios when they are working together and not remotely. So maybe with that thoughts, we can finish this very interesting storytelling session. Once again, I encourage everyone to reply and complete our survey about storytelling in medical affairs. Bernard, Marco, Sebastian, and Tony, thank you so much for taking part in this extraordinary session. We will publish it on our YouTube channel, and please stay safe and hopefully see you next year in Dubrovnik. Take very good care.
Absolutely. It was a real pleasure. Thank you.
Thank you. Goodbye.